Chlamydia trachomatis, or commonly known as chlamydia, results from the transmission by close contact with infected individuals, insects, and flies. As we can all see, contact between these two would result in a massive case of chlamydia. Chlamydia is the most reported sexually transmitted disease in the world. In 2008, there were 1.2 million reported cases of chlamydia. The death rate of people who had this disease is between 5 and 10%, but in severe cases, especially in the elderly, this can be upwards of 30%. Chlamydia was first discovered in humans in 1907. Prior to that, it was originally discovered in plants, but humans ultimately contracted the disease from these plants, hopefully not through any sketchy sexual contact with a dandelion. Yes, I know you like that, Despino. But nonetheless, this disease started to spread through the human race. Chlamydia is most commonly found in South and Southeast Asia. It is obviously also found worldwide, but luckily this disease is most concentrated on the Asian continent. On the screen right now, as you can see, is a chart that shows some percentages, and to be honest, it's rather confusing, but Cooper insisted being here, so there we go. So clearly on the chart you can see that South and Southeast Asia have the highest percentages, and they're getting screwed from this whole disease, whereas North Africa and Middle Europe seem to have the lowest percentages. Symptoms of chlamydia. In women, the symptoms of this disease would be abnormal vaginal discharge and a burning sensation while urinating. In men, the symptoms would be a discharge from their penis that is often white or cloudy, and a burning sensation while urinating as well. Also, there may be pain and swelling in the testicular region. Some signs associated with this disease are pain in the lower abdomen and painful intercourse in both men and women. On the screen in a few seconds will be some pictures that show some of the effects that chlamydia can have on the body. Beware, this is very disturbing and gross. I'm just going to go out and say it, but like another way you could tell if you have chlamydia or not is if you wake up one morning and you can't open your eyes because your eyes are glued shut with this stuff. Yeah. Diagnosis. There are a number of diagnostic tests for chlamydia, such as measuring the nucleic acid inflammation and also partaking in a cell culture. Doctors can also use vaginal swabs on females to test if the patient is positive for chlamydia. Prognosis. Chlamydia can lead to pelvic inflammatory disease if untreated. This can lead to permanent damage to the reproductive organs. Chlamydia can infect pregnancy by causing low birth rate of babies. Also, if chlamydia is not treated, it could lead to a weakened immune system and an increased risk of HIV. Lastly, it could lead you to look like one of the pictures that were shown previously. If that's the case, that would not be great. Due to the fact that chlamydia is a bacteria, it is easily treated with antibiotics. Once given an antibiotic, people who are infected with chlamydia are advised to refrain from sexual activity for at least 7 days. Yes, Sherman, that would include you, hypothetically of course, but don't worry because it would only be for a week and then after that you can do whatever you want. Having chlamydia more than once is very common. People who are infected are more likely to get chlamydia again, and people who are not treated correctly are also more likely to get the disease. Two of the most common antibiotics to treat chlamydia are aripiprazole and doxycycline. Prevention. There are many ways to prevent chlamydia. Due to the fact that chlamydia is an STD, what you can do to prevent this is to practice safer sex. This includes not having sex with multiple partners, not having sexual contact with anyone that has chlamydia. For males, you can use a condom, and for females, apparently, you can use a condom. And lastly, although this is no fun, one could take part in abstinence, or not having any sex. I'm just putting it out there. There's no way that kid enjoyed posing for that picture. He looked way too happy. Just saying. Thank you all for watching. The end. From Zach Michaels and kinda from Zach Cooper.